We all need to take care of our health, and it's especially important as we age. With some advice on proactive health management is Nurse Jackie Hickey of Bayshore Home Health. This is Daily Web TV. Nurse Jackie, what does it mean to be proactive in your health management?
Proactive health management is really looking at shifting that scale from reacting when something happens to stepping it back to being proactive and monitoring and being aware of your health and possibly preventing something from happening in the future.
So what do you mean by monitoring, and how do we monitor?
Monitoring our health can start as simply as getting yourself a journal and writing my health on it and keeping record. If things happen to you and there are warning signs, or if things are changing and you're not feeling well, write it down. Don't take it lightly, and take the appropriate next step and follow up with your practitioner or your family physician.
Yeah, I can imagine it's very easy to forget that lasted 6 months instead of 2 weeks.
Absolutely, absolutely.
Now, when you do something like journaling and go for your doctor's appointments, what kind of things should you be talking to them about?
When you write down in your journal, you're going to be very specific. Because again, and interestingly enough, it was one of the blog topics that I had on the Caring at Home blog through Bayshore Home Health. Because we feel that when you go to your family doctor, you're going completely unprepared. Mm-hmm. So let's pre-plan. Let's write down specifically why we're there, what are the issues, and what is it that we want to discuss with the doctor. Right. And then you have the opportunity to truly sit back and listen. Because half the time we leave the doctor's office, we've completely forgotten what they've said.
That's so true. And I imagine this is even more important as you're older.
It is very true. And that's why if you have the opportunity to go with your parent, I think that's very important. Because again, 2 sets of ears are better than one.
Right, right. Now, what happens if, for somebody who's living at home as a senior, what can they do to get additional help in caring for their health?
There are many organizations out there that will come into the home and help and support them. The My Nurse program through Bayshore Home Health, again, is a very proactive approach to healthcare management. And it looks at monitoring consistently with a healthcare professional, a registered nurse, that monitors the health of the individual, but it also teaches them to monitor their health. It teaches them to be aware of their health so that they can actually take ownership of their own health. And again, writing things down, monitoring, looking at what's happened from 1 month to the next or 3 months down the road can really tell a very good story.
And also, obviously, the nurse can see the changes coming on a monthly basis.
Absolutely. And communicate that back to the family doctor, and communicate that back to the children that may not live in the same city as their parents.
Right. Well, again, Nurse Jackie, great advice on home health care, and thank you so much for sharing these tips.
You're welcome.
Now, if you'd like more information about the My Nurse program or just aging at home, visit bayshore.ca. Keeping you informed, I'm Sheila Clark, and you've been watching Daily Web TV.